When it comes to brain injuries, a mild hit or bump to the head can end up being more serious than you might think. And with fall sports right around the corner, concussions are a timely topic, especially for parents of athletes. Dr. Subramani Sitharama is a physiatrist at Mid-State Medical Center and joins us here on Connecticut Style. Nice to have you here, doctor.
Thank you for having me.
I feel like concussions are in the news more often. Is it happening more, or we have new information about it?
We are able to diagnose them, and we are looking out for them. If you look at the old NFL, football players were getting concussions in every play, and it wasn't being recognized, and they were not being pulled off the field. Now we are more aware of it, and that's why it's in the news more.
And what are some other causes of concussions that you see?
I do mainly pre-adolescents and adolescents, and mainly sports. In boys, football is the commonest cause for concussion. In girls, it's soccer. But we live in the New England area, and lacrosse is catching up pretty quickly for the girls.
And I think we should probably define what exactly a concussion is for our viewers.
Good question. When I talk to parents and kids, I tell them, imagine egg yolk in a bowl or a Jell-O in a bowl, and you shake it.
Okay.
That's what a concussion is. It comes from a Latin term, cocytere, which means violent shaking. So basically what happens is the brain gets rattled in the skull, and there is a storm going on inside the brain with the nerves. The nerves get stretched, bad chemicals come out, there's deprivation of oxygen, there is less blood supply, there's energy starvation of the brain. But when you look at the brain, whether it's an MRI or an X-ray, everything looks normal. That's what's concussion.
And then how does that affect the body? What symptoms do you feel?
So you look at top 3 symptoms. You can have physical symptoms, you can have cognitive symptoms, that means functioning of your brain with memory and reaction, and you can have psychological symptoms. But the top 3 things that we look for, because they give you a good indication of whether a patient's going to have a longer term recovery, is brain fogginess. So you ask the child, are you foggy? Do you feel slow? Do you feel like you're behind in class? So that's very important. The second thing is headaches, post-traumatic headaches, and a migraine type of headache. So if they have a history of migraines, their family history of migraines, that is a sign that it's going to take a long time for recovery. And the third thing is vestibular. Now, the vestibular organ is what sets up your equilibrium, balance. It tells you spatially where you are. So if you tilt your head, you are able to figure out that your head is tilted. And that's a sensory input that goes through the vestibular organ. And that gets rattled. And that can cause a lot of problems. Motion sickness, especially kids walking in a corridor, they feel like they're going to throw up.
Over, sure. So you ask your kids these questions. What happens if you determine it is in fact a concussion? What do you need to do?
So most concussions recover within 3 to 5 days.
Okay.
For Hartford Hospital and Mid-State, we have athletic trainers on the sidelines who are very good guides for us. So if a kid has a concussion, you pull them out. We do a neurocognitive testing. And in about 3 to 4 days, if they're better, they're back on the field. They have to pass their impact test, which is what we call, and they're back on the field and back in school. But if the symptoms are prolonged after 3 to 4 days, that's the time you start looking for a specialist like us. So we are a specialized concussion clinic. So we do a full evaluation, whether it's physical, neurocognitive, psychological, and then we have access to, we have a headache specialist that we refer to if there's a problem. We have neuro-optometrists that we can refer to. If people have vestibular problems, they need physical therapy. And Hartford Hospital and Mid-State has a slew of clinics in the central part of the state where we have vestibular certified therapists who work with these patients.
So you go through that, you recover. How do you know it's okay to go back to playing the sports or going back to school?
So here's the thing. Everybody talks about return to play because this is all about sports. We are a big sports society.
Sure, competitive.
Competitive, right. But for me, it is return to learning. That's, these are kids who are growing, they're going to school. So there's 2 things you want to look for. When is it appropriate for them to be able to attend school? When is it appropriate for them to be able to go back to sports? So my first goal is to try to get them back to school. Depending on the symptoms, you can adjust. The schools, school systems are more knowledgeable about the injury now. They work with us in establishing modifications for the kids so they can get back. Now, imagine a kid getting hurt in May on a school semester. Now June coming up, exams are coming up, probably a junior or a senior in school, and they are looking at taking their SATs.
Colleges, sure.
Right, so they're going to be falling behind. So you want to get them back in that routine. Not everyone is going to be a Michael Jordan or a LeBron James, right? Now, once they get back into school and their symptoms are settling down, we have something called exertion therapy. That means even when the symptoms are improving, we start working them on light aerobic activities. If they do gym, we send them back to gym to do light aerobic activities. Then they go on to moderate level activities and then heavy activities. So by the time their symptoms have settled down, they are ready to go now right to play.
Got it.
Unlike the olden days where you used to rest them till all the symptoms were gone. So then you start putting them into actual whatever sport they're doing, whether it's football, soccer, lacrosse, and see how they do with their symptomatology. If they get symptoms, we back off.
Bring them back, sure.
If they do well, we keep progressing them back to return to play.
And it's great because it's one of the few concussion clinics in the entire state over at Midstate.
Correct.
And you have all the resources right there. So we'll put the information up on the screen. If you think you have a concussion, your child, or you just need some more information, you can visit the Concussion Clinic in Midstate Family Health Center in Cheshire. You can call 203-694-8269. Doctor, thank you so much for all the information.
Thank you for having me.
Very important.